If you're over 60 and dealing with leg pain, whether it's dull aching, burning, or deep soreness that won't go away, you might be thinking it's just aging, arthritis, or circulation problems. But what if the real reason is a simple vitamin deficiency that often goes unnoticed? Thousands of seniors suffer from unexplained leg pain, cramping, tingling, or weakness, especially at night or after walking short distances, and the cause may be a deficiency in vitamin B12. This common vitamin is essential for nerve health, red blood cell production, and proper muscle coordination. When your body doesn't get enough B12, your nerves begin to misfire, leading to symptoms like sharp leg pain, numbness in the feet, burning sensations, or even difficulty walking. And here's the concerning part. Vitamin B12 deficiency is incredibly common in seniors, even if you're eating well. That's because as we age, our stomach produces less acid, making it harder to absorb B12 from food. Medications like metformin or acid reflux drugs can also block B12 absorption. So even if you're eating meat, eggs, or dairy, you might still be low. The good news is that B12 deficiency is easy to fix, but only if you know the signs and take action early. In this video, we'll walk you through how B12 deficiency causes leg pain, the exact symptoms to watch for, the best food sources and supplements to restore your levels, and how to safely get tested and treated. If your leg pain has been a mystery, the answer might be simpler than you think, and the relief might be closer than you expect. Let's dive into how B12 affects your legs and why ignoring it could lead to permanent nerve damage. Ready to begin? Vitamin B12 plays a critical role in keeping your nerves healthy and your legs strong. When you don't have enough B12 in your body, one of the first areas affected is your peripheral nerves, especially those in your legs and feet. These nerves control sensation, movement, and coordination. Without enough B12, the protective covering around these nerves, called the myelin sheath, begins to break down. As a result, signals from your brain to your legs become delayed, or distorted. That's why seniors with B12 deficiency often feel burning, tingling, sharp pain, heaviness, or numbness in their legs, even when they're just sitting. Others may notice that walking becomes more difficult, or their feet feel asleep, or cold despite being warm to the touch. You may also notice muscle weakness, like struggling to stand up from a chair, balance issues, or even occasional stumbling. These are not just signs of aging. They're warning signs that your nerves aren't getting the nutrition they need. And it's not just your nerves. Low B12 also affects your blood, making it harder for oxygen to reach your leg muscles. This can lead to leg fatigue or soreness during light activity. Seniors are especially vulnerable because their stomach acid, which helps absorb B12 from food, decreases with age. Also, if you're taking antacids, metformin for diabetes, or certain blood pressure medications, these can further reduce your body's ability to absorb B12. That's why even seniors with good diets can still have dangerously low levels. If you've had ongoing leg discomfort with no clear explanation, and especially if it's paired with fatigue, memory issues, or numbness, B12 deficiency could be the hidden cause. Next, we'll cover how to recognize the full list of symptoms before it's too late, and how they affect your daily life in ways you might not realize. The symptoms of vitamin B12 deficiency often creep in slowly, making them easy to miss or blame on aging. But once you understand what to look for, the pattern becomes clear. One of the earliest and most common signs is leg pain or numbness, especially in the calves, thighs, or feet. You might feel a burning sensation in your soles, tingling like pins and needles, or sudden cramps even when you're resting. But B12 deficiency doesn't stop at the legs. It also causes fatigue, because without enough B12, your body struggles to produce healthy red blood cells that carry oxygen. This makes your legs feel heavy or tired after walking even short distances. Many seniors also report balance problems, feeling unsteady when getting up, or swaying slightly when standing. That's because B12 affects the nerves in your spine that help you maintain posture and coordination. Another big red flag is memory trouble or brain fog. Some people notice they're forgetting names, misplacing items, or struggling to concentrate. This is because B12 is critical for brain function, and low levels affect both your mind and body. You might also experience mood swings, depression, or anxiety, especially if your leg pain isn't interfering with sleep or mobility. If you've had leg pain that doctors haven't been able to explain, along with these other symptoms, there's a strong chance your B12 levels need to be checked. And if you've recently turned vegetarian or reduced meat intake, your risk is even higher, since B12 is found mainly in animal-based foods. The good news is, B12 deficiency is easy to test with a simple blood test. Next, we'll explain exactly who's at risk, how to get tested, and what to ask your doctor to make sure it's not overlooked. Vitamin B12 deficiency can affect anyone, but seniors are at the highest risk, especially those over 60. As you age, your stomach naturally produces less acid, and stomach acid is essential for breaking down food and releasing B12. Without enough acid, even a diet that includes meat and dairy may not give your body what it needs. You're also at risk if you're taking certain medications. Common drugs like metformin for type 2 diabetes, proton pump inhibitors like omeprazole or pantoprazole, or antacids can all interfere with B12 absorption over time. Seniors who follow vegetarian or vegan diets are another high-risk group, since B12 is found mainly in animal products like meat, fish, eggs, and dairy. If you've recently cut down on these, you could be running low without realizing it. People who have had gastric bypass surgery or who suffer from digestive conditions like gastritis or Crohn's disease are also more likely to develop a deficiency. So how do you know for sure? The answer is a simple blood test. Ask your doctor to check your serum B12 levels and also request a test called methylmalonic acid, MMA, if symptoms are present. Sometimes B12 levels appear normal on paper, but MMA shows the real deficiency. In most labs, a B12 level below 200 pg/ml is considered low, but even borderline levels, 200, 400, can cause symptoms in sensitive individuals, especially if your legs already hurt or tingle. It's important to insist on testing if you have leg pain, numbness, or balance issues. Don't let it be dismissed as just old age. Catching this early can save you from permanent nerve damage. Next, let's explore the best natural food sources of B12, how much you need, and how to safely rebuild your levels starting today. To restore healthy B12 levels and relieve leg pain naturally, the first step is adding B12-rich foods into your daily diet. Since vitamin B12 is only found in animal-based products, seniors who still eat meat, fish, or dairy have several options. The top food source is beef liver, which contains over 70 micrograms of B12 in just 3 ounces, more than 1,000% of the daily value. But since liver isn't for everyone, there are gentler options. Salmon, sardines, and tuna are excellent choices, packed with both B12 and omega-3s that also help circulation and nerve repair. Just 2 to 3 servings per week can make a big difference. Eggs, especially the yolks, are another simple B12 source. Having 2 eggs at breakfast gives you a good start toward your daily needs. For dairy lovers, low-fat milk, cheese, and yogurt provide small but steady amounts. A cup of milk offers about 1 microgram of B12, which adds up if consumed daily. For those who eat little or no animal products, fortified cereals or plant-based milks can help. Check the nutrition label for cyanocobalamin or methylcobalamin. These are forms of B12. Seniors need about 2.4 micrograms per day, but if you're already deficient, you may need more for several weeks or months. Cooking tips include gently steaming fish or baking eggs to preserve the B12 content. Avoid overcooking meats or using high heat methods, as this can destroy some of the vitamin. If you're on a tight budget, canned tuna or sardines are cost-effective and shelf-stable. The key is consistency. Eat a B12 source daily until your levels recover. Next, we'll discuss when food alone isn't enough and how B12 supplements, in pill, liquid, or injection form, can be used safely by seniors. While eating B12-rich foods is essential, sometimes food alone isn't enough, especially for seniors with absorption issues. If your blood tests show low or borderline B12 levels, or if your symptoms like leg pain, numbness, or weakness continue, your doctor may recommend supplements. The most common form is oral B12 tablets, often available over the counter. Look for doses between 500 to 1,000 micrograms per day. These high doses may sound extreme, but since only a small percentage is absorbed, it's safe for most seniors. The best time to take a B12 supplement is in the morning. Ideally with food to reduce the chance of an upset stomach. You can also find sublingual B12, which dissolves under the tongue and may be better absorbed in people with low stomach acid. Another option is B12 injections, typically prescribed if your levels are very low or if you have severe symptoms. These are given in a doctor's office or at home weekly or monthly, depending on your need. Injections deliver B12 directly into your bloodstream, bypassing digestive issues entirely. Seniors with memory loss, numbness in the legs, or long-standing deficiency may benefit from this method. There's also B12 nasal sprays, which offer a needle-free alternative with fairly good absorption. Always consult your healthcare provider before starting supplements, especially if you take medications for diabetes, blood pressure, or stomach acid. B12 supplements are generally very safe, with no upper limit because excess amounts are flushed out in urine. However, if you notice acne, rashes, or restlessness after starting, check the dosage and consider switching brands. Supplements work best alongside a B12-rich diet, not in place of one. Up next, we'll show you how long it takes to feel relief, how to track progress, and what improvements to expect once your levels start to rise. Once you start correcting a B12 deficiency, whether through food, supplements, or both, you might be wondering how long it will take for your leg pain to improve. The answer depends on how low your levels were and how long you've had symptoms. For most seniors, if B12 levels were mildly low, you may notice improvements within 1 to 2 weeks. Many people report a drop in tingling, burning, or cramping in their legs after just a few days of supplementation. If your symptoms were more advanced, such as numbness, weakness, or balance problems, it may take several weeks to a few months to feel full relief. That's because it takes time for nerves to heal and regain normal function. Your body will first use the incoming B12 to correct urgent deficiencies in the blood, and then begin repairing nerve damage slowly. Improvements often follow a pattern. First, less fatigue and better sleep, then improved leg strength, reduced cramping, and clearer mental focus. Keep in mind that if your leg pain was due to multiple causes, such as arthritis, circulation issues, or diabetes, you may still need to address those separately, even as B12 helps. One helpful tip is to track your symptoms weekly in a notebook. Write down your pain levels, walking ability, energy, and any numbness. This helps you and your doctor see progress over time. Blood tests should be repeated every 8 to 12 weeks to make sure your B12 levels are rising and staying in the healthy range. Be patient because nerve healing takes time. But the body can recover well if given the right tools. Next, we'll go beyond vitamins and explore simple lifestyle changes, like hydration, movement, and foot care, that work together with B12 to support healthy legs. Correcting a B12 deficiency is a powerful step toward relieving leg pain, but pairing it with simple daily habits can speed up recovery and protect your nerves long term. First and foremost, Focus on hydration. Dehydrated muscles cramp more easily, and low fluids make it harder for nutrients like B12 to circulate. Seniors should aim for 6 to 8 glasses of water daily, unless advised otherwise by their doctor. Even mild dehydration can worsen nerve sensitivity in the legs. Next, add gentle movement to your day. Regular walking, even just 10 to 15 minutes after meals, helps stimulate blood flow to your legs and improves oxygen delivery to nerves, muscles, and muscles. If you're dealing with weakness or balance problems, start with seated leg lifts or ankle circles to get your legs moving safely. Stretching your calves and thighs before bed can reduce nighttime discomfort. Pay attention to footwear as well. Supportive shoes with cushioned soles reduce pressure on your feet and legs, especially if you're dealing with nerve-related burning or tingling. Avoid walking barefoot on hard surfaces, which can worsen symptoms. If you're overweight, even small reductions in body weight can ease pressure on your legs and improve circulation. Try to include anti-inflammatory foods in your diet, like berries, leafy greens, and fatty fish to support healing. Get enough sleep, as rest is crucial for nerve regeneration. If you sit for long periods, elevate your feet every hour for 10 minutes to reduce swelling and improve circulation. Finally, avoid smoking and limit alcohol, both of which damage blood vessels and worsen nerve pain. When you combine these habits with consistent B12 intake, your legs not only begin to heal, but gain long-term strength. Next, let's address an important warning. What happens if B12 deficiency goes untreated, and why it's so crucial to act now? Ignoring a vitamin B12 deficiency may not seem serious at first, especially if the only symptoms are mild leg pain or occasional tingling. But over time, untreated B12 deficiency can lead to permanent nerve damage, particularly in the legs and feet. What begins as simple burning or numbness can turn into chronic pain, weakness, or even loss of mobility. Some seniors lose the ability to walk without assistance, not because of arthritis or aging, but because their nerves have been silently breaking down due to prolonged deficiency. Without B12, your body cannot maintain healthy myelin, the protective layer around nerves. Once that myelin is damaged beyond repair, the signals between your brain and legs become permanently disrupted. This can result in balance issues, frequent falls, or muscle atrophy. Even worse, nerve damage from B12 deficiency often affects both motor nerves and sensory nerves, meaning you could experience both a lack of feeling in your feet and weakness in your legs at the same time. This makes everyday tasks, like walking, climbing stairs, or standing up from a chair, much harder and riskier. Beyond the legs, untreated B12 deficiency can also lead to cognitive decline, memory loss, confusion, and, in severe cases, dementia-like symptoms. It may even mimic early Alzheimer's or Parkinson's disease. These effects are often misdiagnosed or assumed to be part of aging, which delays treatment even more. The longer you wait, the harder it becomes to reverse the damage. That's why early detection, proper supplementation, and daily habits are so important. If you or someone you love has unexplained leg pain or fatigue, don't wait. A simple blood test could protect mobility, independence, and mental clarity. In the final chapter, we'll summarize your step-by-step action plan to beat B12 deficiency and live pain-free again. Now that you understand how vitamin B12 deficiency causes leg pain and how dangerous it can become if ignored, it's time to take action with the simple, effective plan. Step 1. Get tested. Ask your doctor for a vitamin B12 blood test and, if possible, a methylmalonic acid (MMA) test to confirm whether your symptoms are tied to a deficiency. Step 2. Adjust your diet immediately. Start including B12-rich foods like eggs, dairy, fish, especially salmon and sardines, and lean meats. If you're vegetarian, look for fortified cereals and plant milks labeled with B12. Step 3. Begin supplementation if your levels are low. Most seniors start with 500 to 1,000 micrograms of B12 per day in tablet or sublingual form. If your symptoms are severe or long-standing, ask your doctor about injections or nasal sprays for quicker results. Step 4. Support nerve recovery with healthy habits. Stay well hydrated, walk daily, even in short intervals, stretch your legs morning and night, and wear supportive shoes. These small actions improve blood flow and nerve repair. Step 5. Track your progress weekly. Keep a notebook to monitor leg pain, numbness, energy, balance, and sleep. Noting even small changes helps you see improvement over time and makes conversations with your doctor more productive. Step 6. Avoid habits that worsen deficiency. Limit alcohol, caffeine, and smoking. Be cautious with medications that block B12 absorption like antacids or metformin. Always ask your doctor how to manage these if you need them. And finally, Step 7. Stay consistent. B12 isn't a one-time fix. Your nerves need time to heal, and your body needs ongoing nourishment to stay healthy. By following this plan, you'll not only ease your leg pain, you'll protect your memory, energy, and independence. Make this routine part of your daily life, and you can walk with comfort, sleep without cramps, and live with confidence again.